Hello class, welcome to today's session. Myself Dr. Mariam. Today we are going to explore the topic dengue. So let's get started. Dengue is a viral infection caused by the dengue virus transmitted to humans through the bite of infected mosquitoes. So it is not a contagious what to tell, it is not contagious from person to person except when passed from a pregnant woman to their child, and the symptoms are usually mild with the first infection, but if the patient get another infection with a different version of DE and V, the risk of getting the risk will be leading to the severe complications. And it is usually found in the tropical and subtropical climates worldwide, mostly in urban and semi-urban areas. While many DENV, that is the dengue virus infections, are asymptomatic or produce only mild illness, this virus can occasionally cause more severe cases and even death also. And it is a vector-borne viral disease caused due to the mosquito bite female Aedes aegypti and Aedes albopictus. So there is a brief introduction of what is a dengue and about the dengue viral disease and the how it is caused. Like what causes this dengue virus. Next is the mode of transmission. So the transmission is from human to human through the mosquito bite. When a female Aedes aegypti feeds on an infected individual, along with the blood, it sucks the virus. The virus will multiply inside the mosquito, and subsequently, when the mosquito bites a healthy individual, the virus passes to the human being present in the saliva. It is a vector borne, that is the commonest bite of an infected female Aedes aegypti mosquito, and it is a blood-borne, rarely blood-borne disease, and it can be from infected pregnant mother to a fetus also can be transmitted, or through the blood transfusion or organ transplantation and needle stick injury. So these are the mode of transmission or mode of the way where this infection, this dengue, is transmitted from person to person and what the causes. Next is the incubation period. So there are three incubation period of infectivity, extrinsic incubation period and intrinsic incubation period. In the period of infectivity, an individual remains infective during the period of viremia. Normally it coincides with the period of fever 2 days before and 2 days after, usually 7 days. So this is the period of infectivity. And coming to the extrinsic incubation period, it is a time when the mosquito receives the virus through the feed till it secretes virus through the saliva. So it is roughly around 8 to 12 days. And the intrinsic incubation period, that is 3 to 14 days, is the period from the entry of virus to the clinical manifestation. So in this period, what happens is that in these 3 to 15 days, the virus will able to see the clinical features of this condition. So the patient will exhibit the symptoms of this condition during this period, that is the intrinsic incubation period. So this is what is the period, incubation period of dengue. Next is dengue virus. So we have to know what is dengue virus. So the dengue virus, it is belonging to the genus Flavivirus, and it consists of 4 closely related serotypes DEN 1 to 4, classified according to the biological and immunological criteria. And mature dengue virion consists of a single-stranded RNA genome surrounded by an icosahedral or isometric nucleocapsid. And this nucleocapsid is covered by a lipid envelope. So this is what is the dengue virus. Next is the dengue fever. So dengue fever, it is an acute infectious disease symptom characterized by biphasic fever, myalgia, headache, joint pain, retroorbital pain, body rash, lymphadenopathy, thrombocytopenia, and leukopenia. So, dengue fever is an illness the patient can get from the bite of a mosquito carrying one of four types of dengue virus, that is DENV 1 to 4. And when a mosquito is infected with the dengue virus bites you, the virus can enter the blood and make copy of itself. The virus itself and the patient's immune system's response can make the patient feel sick. And the virus can destroy parts of the blood that form clots and give structure to the blood vessels. And this, along with the certain chemicals that the patient's or the individual's immune system creates, can make the blood leak out of the vessels and cause internal bleeding. This leads to the life threatening symptom of severe dengue. And this dengue fever has three distinct phases: febrile, critical, and convalescent. In febrile phase, it is characterized by a sudden high grade fever and dehydration that can last for 2 to 7 days. And in convalescence period, it is the recovery phase when rash, itching, and increased appetite are observed. So this is what called as basically a dengue fever. Next, moving on to the symptoms and dengue fever cycles. So the symptoms, most dengue infections do not cause symptoms, but if the patient have symptoms, then the most important is the high fever. That is, it can be from 104 degree to degree Fahrenheit is a typical condition or symptoms we can see in the patient. It usually begins 4 to 10 days after the infection and lasts for 2 to 7 days. And the patient also experience severe headache, pain behind the eyes, muscle and joint pain, nausea, vomiting, swollen glands, and rash. So these are the few symptoms which we can see in the condition of the patient who's diagnosed with the or dengue fever. And the dengue fever cycle, we can see the fever will be for 2 to 3 days, and the critical period will be 5 to 6 days, and the recovery phase will be on the 7th day onwards. So this is the cycle how the dengue fever how it circulates. Like first initial 2 to 3 days the patient might experience fever, and in the critical period will be in the between 5 to 6 days, and the last in the 7th day onwards the patient will be able to recover from the condition. So this is the symptoms and the dengue fever cycle. Next is the severe dengue. So when comes to the severe dengue, or we can call this a dengue hemorrhagic fever, it is a life-threatening worsening of a dengue symptom. Warning signs of severe dengue are usually seen 24 to 48 hours after the patient's fever goes away. And there are few symptoms which we can see in the severe dengue. It is severe dengue in symptoms, that is abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue, restlessness, blood in vomit or stool, being very thirsty, pale and cold skin, feeling very weak. So these are the things which we can see in the severe dengue condition. Moving on to the DHF and DSS. DHF is dengue hemorrhagic fever and DSS is dengue shock syndrome. So DHF, as prescribed by the WHO, are acute and continuous fever we can see continuous fever for 2 to 7 days, and hemorrhage will be associated with the thrombocytopenia and hemoconcentration. So this can be seen in the DHF. And coming to the DSS, that is the dengue shock syndrome, it is present with the shock-like features and multi-organ failure can be seen along with any of the above features. That is the symptoms which I have mentioned in the under the severe dengue. So this is what is DHF and DSS. Coming to the dengue hemorrhagic fever. So as I've mentioned, it can last for 2 to 7 days, and hemorrhagic manifestations be positive. We can see positive tourniquet test, epistaxis, bleeding gum, petechion skin, and the patient's low will have experience have will the patient have a low platelet count that is less than 1 lakh mm3, and evidence of increased vascular permeability, that is low bp, high low volume pulse, breathing difficulty, altered sensation. So this is what happens in the dengue hemorrhagic fever, that is in case of the severe dengue fever condition. Risk factors of DHF: if the patient is previously infected with DNV and then the patient is got affected again, then that is one of the complications. And urbanization in conditions, say in cases of population density, human mobility, access to reliable water source, water storage practice, etc., and environmental factors like maybe due to the climatic change or weather conditions. So these are the risk factors of DHF. Moving on to the DSS, that is the dengue shock syndrome. I have explained that before. It may be present with the shock-like symptoms, features, and multi-organ failure can be seen. And there, in this condition, we can see rapid weak pulse, low BP, restlessness, cold, clammy skin, develops mostly after 3 to 5 days of fever, and hypotension and multi-organ dysfunction, low platelet count, bleeding diathesis, dyspnea, maybe fluid in the pleural and peritoneal space, and cardiac failure, and even death also. So these are the things which we can see in the DSS, that is the dengue shock syndrome. Monitoring. So how we have to monitor the patient who is diagnosed with the dengue fever or dengue hemorrhagic fever or dengue shock syndrome. Look for evidence. So check for the hemorrhage, capillary leak or like ascites, pleural effusion, etc. Parameters to be monitored like pulse, BP, urine output, hematocrit, and platelet count. So these are the basic monitoring you have to do if the patient is diagnosed with the dengue. Moving on to differential diagnosis: dengue fever, non-dengue flavivirus infections, malaria, leptospirosis, typhoid fever, rickettsia disease, flu, measles, malaria, typhoid, scrub typhus. So these are the differential diagnoses of dengue. Moving on to the diagnosis. So dengue fever is diagnosed with a blood test first. So we have to do few blood laboratory tests like presence of virus RT-PCR, viral antigen NS1, antibody against virus IgM, IgG from 6 day onwards you have to do, and blood samples you have to do blood sample serum test for RT-PCR and for antibodies in a closed container. So these are the things you have to do in the diagnosing the condition of dengue fever. Examination of blood to detect viral antigen particle or antibodies. NS1 antigen assay usually positive within first week, that is 3 to 9 days. Dengue IgM IgG serological test, both the card and ELISA, and it is only positive after the 5th day, and ELISA are the test of choice after the first 5 days of illness. So this is the few other diagnoses you have to do. Next you have to do few diagnoses during the febrile period before 5 days, that is virus isolation in the cell culture, detection of viral RNA by nucleic acid or amplification test, that is the NAT, and detection of viral antigens by ELISA or rapid test. And next to the diagnosis, we have to do this NSN1 antigen antibodies test. So NSN1 antigen, that is a viral antigen, is a non-structural protein secreted by the infected cells, and this after the onset of illness, the virus can be detected in a serum plasma, circulating blood cells, and other tissues for 4 to 5 days. So in the early phase, detection of viral antigen is diagnostic. And coming to the antibodies, that is the IgM and IgG. IgM antibodies are the first immunoglobulin isotype to appear, and these antibodies are detectable in 150% of patient by days 3 to 5 after onset of illness, increasing to 80% by day 5 and 99 by day 10. And IgM antibodies levels peak about 2 weeks after the onset of symptoms and then decline generally to undetectable levels over 2 to 3 months. And coming to the IgG antibodies, which are generally detectable at low titers at the end of the first week of illness, increasing slowly thereafter with serum IgG, still detectable after several months and probably even for life. So this is the antibodies diagnosis, that is IgG, and IgM. Next is the direct method, what we can do. So first is virus as isolation, genome detection, NS1 detection. Indirect method, antibody detection, that is IgM, IgG, which I have mentioned before with the previous slide, and we have to do with the virus isolation and nucleic acid detection. So these are the direct and indirect methods to do the diagnosis of the condition. And there are few other different tests recommended, that is virus isolation, nucleic acid detection, RT-PCR, detection antigen, serological tests, that is the MAC and ELISA, which I have mentioned in the previous slides, and hematological tests like hematocrit, platelet count is also can be done to diagnose the condition. Moving on to the management. So there is no medicine that treat dengue fever. So managing the symptom is the only way to treat the dengue fever. And if the fever is present with low platelet count or fever with hemorrhages, so whenever fever is sudden, very high with joint pain, vomiting and rashes, think about the dengue fever. Look for the petechial rash, bleeding from nose, gums, hematemesis, melena, restlessness, thready pulse, low BP. Very important to check the platelet count of the every fever patient. Otherwise, this dengue will not be detected till the bleeding starts. So, if the platelet count is less than 1 lakh, then test blood for platelet count every day. HB, WBC, dengue, IgM test. Hospitalized if the platelet count is less than 50,000. For a fever, we can prescribe paracetamol only, no aspirin or NSAID for fear of bleeding, plain analgesics for pains, and plenty of oral fluids, IV fluids to prevent shock. Bed rest is advised. If platelet count is less than 20,000 or if bleeding, then platelet transfusion is advised. If internal hemorrhage and hematemesis or melena, then blood transfusion is advised. If shock, treat with IV fluids, colloids, dopamine drip, steroids, and injection F-Corlin 2 amps, 2 ampule IV 4 to 6 hourly can be prescribed. And if the patient is having this fever with severe joint pain, then you have to look for other condition like chikungunya, etc. So this is the management you can do with the to diagnose treating the patient, and ask them to keep them hydrated by drinking plenty of water and fluid, and ask them to get as much rest as possible. And you can treat the patient with the pain of the patient with acetaminophen like Tylenol only, and do not take ibuprofen like Advil or aspirin. This can increase the risk of life-threatening internal bleeding. So make sure that you have noted the points which I have mentioned. Moving on to the vaccine. So the vaccine is called as dengue vaxia, which is recommended for people who have had dengue at least once in their lives, who lives in places where the disease is very common. So far, only one vaccine, that is the dengue vaxia, has been approved and licensed in some countries, and dengue vaccine is only for people showing positive past infection and remaining dengue endemic region. So this is the vaccine, and this vaccine is have been approved and only licensed in some of the countries. Okay, moving on to the prevention. So the best way to reduce the risk of dengue fever is to protect the patient from mosquito bites. So we have to make sure to add include some of the steps which I am going to mention now in their lifestyle. You have to advise them, cover this exposed skin doors, and especially at night when the mosquitoes are more likely to be around. Remove standing water like buckets or barrels, a bird bath, old tires that may hold rainwater and fill loose spots where water can pool. Keep mosquitoes outside of the home by repairing holes in the screens and keeping windows and doors closed if possible. Use mosquito netting at night in areas where dengue is common, and if the patient is pregnant, avoid traveling to areas where dengue is common if possible. And when traveling, be sure to check to understand if there are any outbreaks of illness in the destination you are going to travel before you leave. So these are the few things you have to keep in mind. And you have to advise the patient to get preventing from getting infected with the dengue virus and with dengue fever, etc. So this comes to the end of our topic, dengue fever. Thank you.